Project PrIDE is a 3-year demonstration project funded by CDC. It stands for PrEP Implementation, Data to Care and Evaluation, to identify how we can increase PrEP uptake among men who have sex with men and transgender women, focusing mostly on African American and Latino populations. Health departments were not funded to implement or address health equity or social determinants of health. Our health departments really said, this is what we need to do. We've got to address this.
They said, yes, this is an HIV project, but if we don't deal with some of these health equity issues, if we don't deal with this mistrust that has been there for years, then it's not going to work.
The individuals involved in providing those services need to be people who are trusted by the populations they're providing the services to and able to show an emotional investment in that work. And folks have really learned the struggles of providing those services to populations that don't trust us.
We have to be willing to have very honest and frank conversations that these systems, these racist systems, these homophobic, transphobic, heterosexist systems are what is perpetuating burdens of disease in very specific communities. And when we start to take stock that we are part of that system, it then helps to transform the way in which we approach this work.
Coming from the state health department, I am simply a guest in the community that I hope to serve. So I need to go to the community to make sure that they guide the work that we're doing.
This year we moved into having trans-Pacific task force, and so because they were our priority population groups, it was amazing to be able to have their voices at the table, not the voices of people who were representing them, but their voices at the table.
The Learning Collaborative has been a place where we can lean on our colleagues, our experts, to help us figure things out.
There was so much love in the Learning Collaborative. It just felt like a powerhouse of people all working to achieve the same goal.
PrIDE has catapulted us forward, and even as the project is ending, we have to keep that focus on the disparities work. We have to take the lessons we learned about collaboration and engaging community and thinking differently and continue to incorporate that and weave that into the fabric of our work.
We have to have the wherewithal. My wherewithal piece is about folks having the heart for it, not just having a job for it, but having the heart for it, because what comes from the heart reaches the heart, and that's what's going to really make a change and a difference in the communities.